We as a society are not supporting long-term care in the way it should be.
We know that depression in the elderly is chronically undertreated.
Closing synagogues and churches and mosques have taken away a very important aspect of life for seniors.
From the Zoomerplex in historic Liberty Village, the Zoomer with Marissa Lennox.
Welcome to the Zoomer. I'm Marissa Lennox. For over a year, we've been told to social distance and stay home in order to reduce our exposure to COVID-19. But sheltering at home has also meant staying away from the people that we love, our friends and our family. The emotional toll of such sacrifices is steep for most everyone, especially seniors. On today's show, we'll discuss how and in what ways have the events of this past year affected the mental health of seniors. And we'll ask, when does the cost of such restrictions become too high a price to pay? But before we dive in, let's tee up the topic.
In a new CARP survey, 42% of older adults say their mental health worsened during COVID. And only 10% of respondents sought assistance for it. Among the top factors, access to medical care, financial insecurity, and most profoundly, isolation. The results echo a national study which found that 40% of Canadians have seen their mental health deteriorate since the pandemic began. 17% reported increased substance use, including alcohol, cannabis, and prescription medication. On the flip side, 54% reported exercising more outdoors, and 36% connected virtually with friends.
Dr. Khan, let me start with you. How has COVID affected the mental health of seniors?
Well, seniors, of course, are a very varied group, but I think on the whole, it's been a very difficult time. And you know, we are a species that thrives on relationships and social connectedness. And as stated in the introduction, to stay safe, we've had to socially distance, although even that term is wrong. We've had to physically distance. We don't want to socially distance, but we've been thrown into that situation. So I think we're seeing a lot of anxiety, especially in the early stages of the pandemic. And that's evolved, I think, now into more depression as the months have gone on and on. We're going into a second year now. So I would say that the situation is difficult, and it depends on the situation, obviously. People in the community versus people in long-term care, and I know we'll address that later. But overall, I think we're all very concerned about the impact on the mental health of older adults. Very difficult.
Dr. Crames, what have you witnessed this past year? Of course, you're a caregiver to your wife.
Well, I'm a care partner. We work together. She's my caregiver as well. It has made things physically more difficult. When we go to the hospital or the clinic for meetings, I stand out in the parking lot with my cell phone while she goes inside. A lot of care that was given in the hospital, she's administering to me, and I'm administering to her right now. So it's meant stepping up and taking more control over our health than we had in the past. And fortunately, the system has allowed us the freedom to be able to do those kinds of things.
Mm-hmm. Amy, what have you heard from caregivers and others about how the pandemic's affected their mental health?
You know, this has been one of our top concerns at the Ontario Caregiver Organization since the start of the pandemic. And we heard from caregivers from the very beginning that they were taking proactive measures to self-isolate long before public health guidance was being implemented along that line. So many caregivers have been in significant stages of isolation for a year now. It's affected their mental health, including in terms of anxiety, depression, and in particular, that's exacerbated when they're caring for someone who has mental health or addiction issues.
And Bill, how about you? What have you heard from CART members?
Well, as both Amy and Dr. Krames said, there have been many consequences of the rules and regulations that have been set down that have had the kind of unintended results. And we're certainly hearing that seniors, older adults, don't feel that they have been involved in the decision-making around keeping them safe. And that's created even more anxiety. They're saying they want decisions made with them, not about them. And they're feeling that have lost control over their own lives because of rules that others are making, well-meaning though they may be, that are really affecting their lives and not allowing them to make the decisions for themselves they think they should be able to make.
You know, Dr. Gorfinkel, I want to pick up on what Bill just said. When all is said and done, and we reflect back on how we did, and we look at the policies that were implemented, will we say that perhaps inadvertently we caused an echo pandemic of mental health issues?
I think the realistic way to look at this is that the problem began even before the pandemic. It began because society views old age as depressing. The assumption is that it's logical for old people to be miserable, and that prevents us from ministering to that misery. So depression was chronically undertreated to begin with. Consider that 14% of those over 65 are in fact depressed, clinically depressed. So what happened with the pandemic is that only exacerbated a pre-existing condition.
Dr. Krames, same question to you. Are you concerned when we reflect back that maybe we made some decisions that were not the right decisions at the time, and perhaps it could have an echo pandemic effect?
Well, I agree with both Dr. Garfinkel and Bill. I think the pandemic has simply opened a Pandora box on something that was happening anyways. It's exacerbated the problem. We live in a society where as we age, we become what Bill Thomas has called elders. And our role in society is to be there to influence the next generation. And I think all the time with the internet and people getting their information and culture being driven by electronic means, that seniors have lost a sense of import in terms of playing that role as being the elders in society. And I think that has led to kind of a sense of learned helplessness, which has been exacerbated by the restrictions put on us because of the pandemic.
All right, well, we'll pick that up after the break. We need to take a short break now. There's more when we return.
Closing synagogues and churches and mosques have taken away a very important aspect of life for seniors.
Welcome back. According to the results of a new CARP survey, 42% of older adults saw their mental health worsen during COVID. The results mirror a new national study, which also found that 40% of Canadians have seen their mental health deteriorate since the pandemic began, with the decline more pronounced in those with a pre-existing mental health issue. Now, Bill, you know, these numbers, they're hard to ignore. And I'm not saying, therefore, we should lift all of the restrictions, but I think it is worth asking, you know, at what point do the sacrifices we've made for nearly a year now outweigh the good?
Yeah, absolutely. And, you know, I had one 91-year-old woman say to us just before the holiday season, shouldn't I be able to make the choice whether or not I spend this time with my family this year? I may not be around for next year. Shouldn't I be part of the decision? Individual choices seem to have been eliminated by the severe lockdown. And as I say, well-meaning, although they may be, they really affected people. And they don't know what to do about that. One of the problems is, as we'll talk later, they don't know what resources are to help them or what they should do to gain their own control over their own lives once again.
You know, Dr. Khan, we know all too well that isolation can be dehumanizing. And so, you know, when does the cost to one's mental health become too high a price to pay?
You know, this is a tricky balance to find because we're trying to, difficult question to answer. I think that it does come down to individual risk. And some people might say, I'm prepared to take the risk to see my grandchildren, even though they're going to school. And others might say, no way, I don't want to take that risk. So maybe we should be allowing people to assess the risk and consider that in terms of their social interactions. On the other hand, though, we do need to protect each other. So I think it's very tough.
Dr. Gorfinkel, same question. Is there a better way?
There absolutely is. And that is that long-term care, that facilities, that families, that communities need to ensure that seniors who are at high risk, who are in social isolation or in quarantine, have access to technology that connects them to society. Can we utilize technology to its fullest extent to bring it to seniors who otherwise would not have access to their families? And I think this is greatly underrated and underutilized. Are we ensuring that seniors have a solution to the loneliness and social isolation? So even as a medical system, we could be doing more to connect these seniors to other seniors. I need to be able to prescribe a solution for my patients who are lonely and isolated.
But how about from a policy perspective? I mean, that's introducing technology to help remedy the issue that's been created. But what about from a policy perspective? To Bill's point, should seniors have been included more in some of these discussions? What if someone was to say, I'm comfortable taking this risk because my mental health is more important to me?
They're involving other people's health. That's the problem. It depends on how common COVID-19 is in a specific area. We have seen how that long-term care facility in Barrie, it went through like wildfire. In the space of 2 weeks, virtually everyone became infected. And that's a serious problem. So is it really one person's right to even say, I need to see my family and therefore they will come into the facility? I think that's very, very risky and dangerous. We simply cannot do that. We don't have that power. In a pandemic, we think not in terms of the individual, but we start thinking in terms of what saves the most lives.
Dr. Crames, do you agree? Or have politicians been too black and white? Could there have been more room for nuance?
I think that in fact, what we're looking at is something we can call benevolent ageism. It's compassionate but paternalistic, taking away our ability to make our own decisions. And it's interesting, if you think about it, most of the people my age, my friends, will tell you that some of the people that guard us the most are our own children. I got a phone call from my daughter. Where were you? Did you go shopping? And what are you doing out there? We're being watched. We're being cared for in a way that we are used to taking care of others. But it's a kind of ageism. It's very paternalistic. One of the places, by the way, this is very obvious, is taking away spiritual life. Closing synagogues and churches and mosques have taken away a very important aspect of life for seniors.
Amy, could the government have been more nuanced in their response, specifically as it relates to caregivers?
Our focus is really on the programs and services, and it relates back to the comments of a number of people on the panel here, because what we've done, as many organizations have, is moved our programs online so people can connect with others in that caregiving context through group coaching, through one-to-one counseling, through peer mentorship and peer support. And those can be great ways for people to have those connections through the technology or even by phone in a time when we're not able to connect in person.
Mm-hmm. All right, well, when we come back, the mental health crisis in long-term care settings, that's next.
We as a society are not supporting long-term care in the way it should be.
Welcome back. Seniors living in long-term care homes have accounted for a disproportionate number of infections and deaths due to COVID-19 in Canada. Amplifying this devastation is a mental health crisis fueled by prolonged isolation and intense loneliness. While provinces loosened visitation rules last summer, additional restrictions were later imposed with the second wave. Bill, seniors living in long-term care settings, literally had no contact with people for weeks on end at the beginning of the pandemic. And we're starting to see a little bit of that again now with the second wave. What impact has that had?
Well, it's had the impact that they have felt the isolation, the anxiety, the fear, the lack of understanding. Remember, up to 50% of the people in our long-term care homes suffer some form of dementia, and they don't understand what's happening with them, why people are avoiding, why they can't see their families, or the families, as they see it, don't want to see them. And one of the big issues has been because of the lack of frontline staffing and people to work and spend time with the patients in long-term care. Taking the family caregivers out of the picture has created a whole different kind of problem. Remember, family caregivers were giving much of the care in those homes. So they've not only had the lack of physical care, but they've had the lack of mental stimulation too. And we're hearing some terrible stories about families who were able to get in after a long period of time of not visiting their loved ones and finding they had deteriorated mentally tremendously during that time. And that's an issue that's going to take a long time to repair, if it can be at all. And the families and the older adults themselves don't know what resources they can turn to.
Well, and you're right. I mean, I heard similar stories where family wasn't recognized by their loved one anymore because they had deteriorated so much. Amy, now I know Ontario has taken steps to remedy this. I don't think it's the case across the rest of the country. But how important was it when Ontario made that step to allow back in family caregivers? And do you think that the rules were clear enough for people to really understand what needed to be done, or was there a more progressive approach?
You know, it's vitally important to recognize essential caregivers in long-term care as well as other contexts. And I really appreciate Bill's comments about both the physical and mental health supports that caregivers provide. They're an integral part of the healthcare system, whether that's in long-term care or beyond. And so we were pleased when we saw that move of recognition, and it aligns with some of the supports that we've provided to long-term care and to hospitals in Ontario around caregiver identification and making that process smooth and easy. We want caregivers to be included to the greatest extent that's safe and healthy, and that includes looking at those infection prevention and control measures that make it safe and appropriate for everybody involved, including caregivers.
Dr. Gorfinkel, what has been your experience in the pandemic? What stories have you heard from people living in long-term care homes and how they've been affected by the isolation?
The take home is this: to the degree that a person can maintain their connectivity to the humanities, and when I talk about the humanities, I'm not only talking about personal touch, being with somebody, whether that's a caregiver or family member. I'm also talking about staying in touch with things like music, poetry, literature. I recognize that that's not always possible, but a sense of generativity. What I do makes a difference. What I do matters, because each and every one of this is associated with less depression, less anxiety, increased hope. There are several positive aspects to that I think are largely not taken advantage of, because everyone deserves mental health, including those with dementia, including those in long-term care.
Dr. Khan, what have you experienced? What have you heard from people living in long-term care?
Well, first of all, I want to state that what we spend on long-term care, 1.3% of GDP, is about half of what they spend in Scandinavian countries like Denmark and Norway. We have to recognize that. We as a society are not supporting long-term care in the way it should be. That's the first thing. The second thing is it's possible, as Dr. Gorfinkel said, to deploy virtual resources to connect people in long-term care to their loved ones and to other resources that can really help them. So at Baycrest, where I work, we got cracking really early. We had iPads on wheels all over the organization, and that certainly made a difference. But the change in policy to allow family caregivers back into the long-term care facilities was huge and has made a really big difference.
Dr. Krames, you mentioned earlier that, seniors need to have more of a say. Do you think we've lost sight of the fact that the seniors are adults and that they can make decisions for themselves to some extent?
Absolutely. Locking seniors in nursing homes and long-term care homes is really blaming the victim. And what we need to be able to do is recognize, although all the statistics about mental illness and health is true, we need to recognize that seniors are particularly resilient. Seniors have gone through a lifetime of experience, and they have a tremendous amount of resilience that they can call upon to get through a lot of this. And part of it means being able to maintain connectedness, whether it's virtual or real. But to isolate people and to put them in the condition we did was really a matter of, to my way of thinking, of blaming the victim.
I'd like to push back a little bit on the blaming the victim part, if I'm able to.
Yeah,
and the reason I say that is because, there are many people who will be watching the segment who, in fact, have parents who are in long-term care, and they've had to struggle with a very difficult decision of how they are going to manage that space. Having a parent living in your living room and, tending to everything from their toileting to their feeding we can't understate the impact that has on people. We need to give that a little more nuance. No, these people are not being locked in. It's actually, there are long waiting lists to get locked in, if you want to call it that.
Dr. Krames, do you want to respond?
Yeah, I think you need to look at the nature of what caregiving is really all about. Most, if not all, caregivers begin with a relationship, whether it's parent to child, adult to spouse, whatever it is. When you become a caregiver, the dynamic changes. There is a sense of sorrow that comes into playing the role of being a caregiver. And what we need to do is to recognize how what we're looking at here are relationships and how those relationships are being changed, either because they're being forced to be changed or because people cannot maintain them. So I think we need to look at what we're doing in terms of the relationship between people.
Okay, we need to take a short break. There's more when we return.
Human touch makes a difference, and that we're all lacking during the pandemic. It can be very difficult.
The gang at Zoomer Media and I are always in search of positive and uplifting stories we can share with our audience members, especially during times like this. So when I got the call to feature this next piece, I said, I'll pack up my bags because I've traveled to Exeter, Ontario here to film these guys who are visiting a local seniors home in hopes that they too can brighten their day.
We had some alpacas from Sylvan Farms come to visit us and say hello. They came up to all our windows and all the residents were able to come and say hi, and it was just an unbelievable experience and a lot of community support.
Oh yes. If anything, they have trouble with the heat. This is Jimmy and Ned and Floyd. It's just been smiles, right? Unfortunately, we don't get to talk to them, but we answer any questions by email that people have.
What's some of the common feedback you've been getting?
Just it makes more of a difference than we realize. We get messages from sons and daughters of people who are in the home and just saying thanks.
I thought I was pretty damn lucky to get out here and see them. To think that they'd come all the way out with those little animals.
Well, the difference is an animal that you don't see that often.
It does give you something different to think about. I think that's rather than, what'll I do next with my life?
Floyd, who's this?
Well, it's not just farmers Nick and Steph who have come up with unique ideas to better the health of seniors throughout our province. I'm joined here in my apartment on a Zoom call with Anne from Lions Head, Ontario, and she's been doing something very similar in a senior home she works at with animals.
Yes, I have been raising monarch butterflies from eggs to release for the last 25 years and been doing it at the Golden Dawn Nursing Home now for the last 4 years.
Is it true? Do people just kind of sit around and have these eggs hatch all around them?
Actually, we sit and watch. It takes 4 or 5 days to hatch them, but then they turn into chrysalis, which everyone enjoys watching. and then from a chrysalis into the monarch, and we do sit around and watch them outside. We keep them pretty busy. I mean, yes, they are depressed. It's been really awful that they can't go out, they can't see their family, and it does help them to know that we've already started planting seeds for milkweed, so it certainly does help.
And remember, for more insightful and positive COVID-19 stories like this, you can visit our Zoomer Media YouTube page. Here in Toronto, Sean Stante for theZoomer.
Thanks, Sean. While the initial rollout of vaccines gives us hope for an end to the pandemic, these vaccines aren't yet available to the general public. In the meantime, most Canadians tired of being isolated, scared, and uncertain are wondering how to cope. Dr. Gorfinkel, what are some ways to beat loneliness?
I really believe the connectivity to generativity, feeling that you're making a difference, which is not easy during a pandemic, helps. But basics, and this is really kind of simple. Make sure your vision is good. Make sure what you're hearing, you can hear well. Make sure that you're eating healthy, exercising where you can. Sleep matters. As we age, what happens? Sleep becomes fragmented. We have more awakenings at night. Actually, the levels of neurotransmitters in the brain altogether are lower as we age. And if the need for an antidepressant medication is there, we need to start low and go slow. And when are antidepressants necessary? If there's such unhappiness that it affects everyday living, the concentration, the motivation, where most days are terrible, then that means, and it's ongoing for at least a couple of months, that's when you know that medication may be of interest. So reaching out for help, even if that's virtual help, even if that means a telephone call with a doctor, that's still important, because we know that depression in the elderly is chronically undertreated. And I've seen many seniors come alive when they are treated properly with medication, so that then they can do those other things: sleep better, eat healthier, reach out for more connectivity, and be able to concentrate and have the memory to do those things.
Sure, but at the same time, if there are certain variables that are contributing to that loneliness and to that depression, I mean, I would hate to just fall back on pills.
Great thing, but the problem is this: getting older is depressing. People lose family members. People watch people get sick. There is more sickness. There is more death. So naturally, being older is a miserable state. To which I push back, and I simply say that if the clinical definition of depression remains the same, the response rate remains the same. They will still respond. If somebody is living a life in which most days are miserable, they are having trouble getting up out of bed, and we're talking about this sort of misery. They've given up on doing their hair. They've given up on, looking after themselves. We see basic features of everyday living. The activities of daily living are disappearing. Those are indications of real clinical depressions, and they should not be treated simply with my prescription of generativity. They should be considered as medical problems that need medication. And medication is not a bad word, because medication can make a big difference in seniors' lives. And I share with you, clinical depression is vastly undertreated.
Dr. Khan, you jump in here.
Sure. So I'm a geriatric psychiatrist, so I wanted to agree with Dr. Garfinkel that we should be on the lookout for clinical depression, and that antidepressants can be really helpful. But I also want to emphasize that there are other forms of treatment for clinical depression, including psychotherapies, talk therapies, such as cognitive behavior therapy, which has actually been shown in mild to moderate clinical depression to be as effective as antidepressants. So there's a lot of things we can do. And sometimes the best combination is actually medication and psychotherapy. So I wanted to emphasize that.
Bill, I think COVID-19 has laid bare rampant ageism in society, from expressions that you read on signs to articles that have been written throughout the course of this pandemic. What will be the lasting effects of that? Or do you think seniors, which again, I agree are not one big homogenous group, but are they more resilient and are they willing to just sort of brush it off? What do you think?
Right. Well, first of all, I hope we're not concentrating too much today on those in long-term care, because 90 to 95% of older adults in Canada are still living at home or in their own communities or with families, and they're suffering the same kind of isolation, and we have to watch out for them too and be concerned. In fact, often they are feeling even more isolated than those who are in congregate settings, and it's important that we realize that we need to have them feel optimistic and positive about what the future may bring, and know what they can do about it. There's still a stigma about being concerned about your mental health. In the CARP survey that we did, we found that of the people who did look for help, 76% of them felt that would give some kind of stigma to them with their friends and their families. Well, if the ones who actually reached out felt that way, how do the ones who didn't reach out because they were afraid of the stigma? We've got to let people know that the feelings and the way they're being treated by COVID and their situation now is not unusual. Many people have it, and we need to help them navigate to where they can get help. And one of the biggest problems today is that seniors, especially those living outside of facilities, don't know where to turn when it comes to dealing with their mental health.
Mm-hmm. All right, there's more after the break. Stay tuned.
Symptoms of anxiety and depression and even suicidal thoughts are increasing.
Welcome back. I had a chance to sit down with Louise Bradley, President and CEO of the Mental Health Commission of Canada, for her take on how COVID-19 has affected the mental health of seniors. Take a look. Louise, thank you so much for being here and for your time. What have you learned throughout COVID, looking at polling data, looking at other research, about how this pandemic has impacted the mental health of people, and specifically that of seniors? What do we know about how it's driving these increases in mental health illnesses?
Well, actually, the Mental Health Commission of Canada did 2 polls, and we'll be doing others as time progresses. Last fall, we did one in October and then another one in December. And quite interesting, it was the fact that seniors were actually doing better, reporting better mental health than the general population. Somewhat of a concern is that during the second poll, and this was 4,000 people online that we surveyed, the second time showed a reduction in how people were feeling about their mental health. So I think there's some cause for concern there, but it was interesting that older adults were faring better than the general population. Also in the areas of reporting on things like anxiety and depression, they were also doing better, but again, that decreased in the second poll.
And we do know that there has been a general decline when it comes to mental health throughout COVID, and that's no surprise. Yep. So how do you think the pandemic has then shined a light on the need to tackle mental health issues in Canada?
Well, we knew the situation wasn't great before the pandemic. In fact, there were about 1.6 million people who reported an unmet need in mental health. And so with the precipitous drop in mental wellness during the pandemic, there's every good reason to believe that that is going to continue. It's also true that symptoms of anxiety and depression and even suicidal thoughts are increasing. However, I don't think we should worry that there is necessarily a echo mental health pandemic afterwards. I think it's a matter of trying to do things differently. I mean, if there's a silver lining in this pandemic in terms of mental health, I have seen a shift in the provision of e-mental health services in the past year more than I'd seen in the previous 10 years put together. And I see that as a positive thing, but we need to have standards to make sure that it is being provided in the right way. So I think it's really important that that we try to look at these standards development and so forth going forward, so that there isn't necessarily an echo mental health pandemic following all of this.
And you don't believe that there will be an echo pandemic, as many people have warned that it's inevitable?
I don't think it's inevitable. I think it is inevitable if we don't do things differently. And so that's why groups like the Mental Health Commission of Canada and many other wonderful organizations across the country are really pushing governments and organizations to not only invest in mental health, but to look at innovative ideas, because it's not just a matter of throwing money at it. It's a matter of trying to do things differently.
And I think Canada has a long way to go. In a recent CARP survey, 42% of adults said that their mental health worsened during COVID, but only 10% sought help for it.
Yeah.
Why do you think that is?
Well, I think that it's not dissimilar to what the general public is experiencing. Stigma is a huge factor. It is a huge factor. We've come a long way, but we still have a long way to go. And for older adults, I think that it's dual stigmatization because it's ageism. I mean, we tend to think, oh, well, he or she is depressed, or, they're isolating themselves from other people. Well, they're old. What do you expect?
Right.
And that is simply not the case. Just because somebody is elderly does not mean that you should assume that they're going to be depressed. They have no more reason to be depressed than somebody who is middle-aged. So I think that ageism plays a factor. To speak to your earlier point about how can we avoid an echo mental health pandemic, that governments at all levels, I think, have a wonderful opportunity as they are developing their 2021 budgets to really take a look at this and to focus on the needs of older adults as well. And we know that when patients receive flexible access, that they can determine what they need, that sometimes 1 or 2 sessions are all that's needed, but they need to be provided when they are needed. And we haven't had an opportunity to talk about suicide prevention, but I think that that's something else. I mean, that was terribly underserved. The data around it, we don't know well, even before the pandemic. There's a program, a community-based program called Roots of Hope that's being piloted in 8 communities across the country. If we could see more of those. So I think there's an incredible opportunity, but if we don't take it, I fear that the pandemic that you're referencing will be all too real. And I don't think any of us want that.
Certainly not. Louise, thank you so much for your time.
Thank you for having me.
All right, when we come back, we'll hear some final thoughts from our panelists. Welcome back. With only a few minutes left, my panelists will leave you with some of their final thoughts. We'll start with you, Bill.
One of the things we haven't talked about is the lack of funding for mental health, especially mental health for seniors. And as long as governments only give the crumbs left over after acute care, we're going to continue to have this problem. We need more attention put on the fact that mental health is a huge problem among older adults in Canada today.
Dr. Khan.
I actually want to congratulate ministries of health across the country for supporting telephone calls and virtual care, allowing physicians to bill for those in a way that they did not in the past. And that's opened up care for a lot of people. You know, a telephone call, a telephone conversation, or a video call can make a huge difference. And I'm hoping, especially for older adults who find it hard to travel, I'm hoping that post-pandemic, the governments will continue to fund those services.
Amy.
We've talked a lot about learning what's available in your community, and our 24/7 caregiver helpline is a great resource. That exists as well in other provinces, BC, Alberta, Quebec, and Nova Scotia. So if people are wondering about health, social services, and other supports in their community, I encourage them to give us a call to find out what's available and how it's evolved during the pandemic.
Dr. Crames.
Yeah, I'd hate to leave with the impression that getting older is depressing and only leads to mental illness. It happens to be a wonderful time in life. It's a time when we have being as opposed to acquiring. It's a time where we're spiritual. And I'd like to just point out, if we stick to the medical model, what we need to recognize is there's a difference between cure and care. And when we can't cure anymore, we still have responsibility to care. And what we need to be aware of is that there are limitations to cure, but there are no limitations to caring for people. Thank you.
And Dr. Gorfinkel.
The journey to inner peace, the journey to generativity can be a difficult journey, especially during a pandemic. So the question is, if there is in fact a clinical depression happening where most days are horrible, and you're having trouble getting out of bed, you're having trouble rousing yourself, bathing, doing the simple activities of daily living, I would implore you to reach out for help. We know that clinical depression is vastly undertreated. And when I say treatment, I don't just mean medication. I'm talking about all of the wonderful therapies that my colleagues have just recommended. That may be a possibility, but medication may be a possibility. The first step in healing is holding the problem away from oneself, identifying it so that it can then be acted upon. I wish you the very best in this pandemic. My thoughts and prayers are with you, and please know that there is hope.
All right, that's all the time we have. Thank you to my panelists so much for being here and for you at home watching. We'll see you soon. For now, it's time to zoom out.